Make the ground shake.
Hello everyone. The topic of our first lecture of the model cariesology and the diseases of hard tissue of the tooth is methods of diagnostics of caries and non-caries lesions of hard tissue of teeth and classification of caries. Our plan: first, methods of examination of dental patient with diseases of the hard tissue of the teeth. Next point, medical documentation, rules for its registration, and the third one is classification of dental caries. First issue is methods of examination. All methods during examination are divided in two main groups. First group is basic or main methods, and the second one is additional methods of examination. First group, basic methods, includes several methods. First, interview, which is consists of complaints, anamnesis morbi or history of disease, and anamnesis vitae or history of life. Number 2 is inspection. Number 3 is probing. 4 percussion, and the last one is palpation. These methods corresponds to basic. First main big group, basic, and the second big group is additional, which includes thermometry, electrodontodiagnosis, radiography, vital staining, luminescence, trans illumination, and laser flowmetry. And now about each of them in detail. First, we start with basic methods, and usually we start our examination with interview with patient. Just speak with patient to find out his complaints. Interview is carried out by questioning the patient, and we have to ask some important questions. For example, what do you think the problem is? Does it hurt to cold or hot? Does it hurt when you chewing? When does it start hurting? How bad is the pain? What type of pain is it? How long does the pain last? Does anything relieve it? How long has it been hurting? And so on. First, we find out complaints. What patient feels? Pain or something like that. And the main complaint in dentistry, in cariesology, is pain, and we have some characteristics of pain. To make an accurate diagnosis, dentists are guided by the type of manifestation of pain. The fact of presence of pain, yes or no. Pain may be or without pain. Causality, it may be without reasons. It is called spontaneous pain or spontaneously, or causative, when pain appears from some reasonable. Duration, it may be short term or long term, short pain or long pain. Next characteristic is intensity. It may be acute or aching. Acute pain is very strong, aching not so strong. Next, the presence or absence of light gaps. Light means without pain. Next, irradiation. It means pain is given in the ear or neck or head or some another part of head most often. And development in time. This is characteristics of pain. Pain is main symptom in dentistry, in stomatological examination. Next, in interview, next part of interview is anamnesis. During the survey, the doctor finds out the history or course of life and disease, as well as the general well-being of the patient. And first, anamnesis morbi, history of disease, and the purpose of this method is to determine the development of complaints over the time. For example, the nature of pain, acute, aching, weak, strong, the time of occurrence, frequency of attacks and their periodization, factors that contribute to the strengthening and subsiding of pain. Preventive measures were taken by the patient and the way of self-help that the patient provided to himself. And the last part of interview is anamnesis vitae or history of line. First part of interview is complaints, second anamnesis morbi, and the third anamnesis vitae. This is interview still. The purpose of the life history is to establish the presence of general somatic disease, to find out the some allergy or its history, to find out the conditions of life, work, region of residence, to identify a deficit of fluoride, for example, to learn the patient's diet, especially during teething and bite changes, and to detect the features of the chewing process. Next method, number 2 in basic group, is inspection. And first we assess the general status. Assessment of general status of patient. Visual assessment of the physical and emotional state. It may be satisfactory or unsatisfactory, caused by pain, poor sleep, loss of appetite, and so on. And more detailed assessment of local status. We start with an external inspection of the maxillofacial region. First, configuration of the face. It may be normally the face symmetrical and proportional. Next, view skin color, palpation, and some other characteristics. Usually it's in normal healthy patient, it's normal skin, pale pink color, clean, easy to fold. Next we assess red border of the lips and also visible mucous membranes. The nature of clothing of the lips, their contour, the presence of scales and crusts, pallor or hyperemia of the visible mucous membrane, and also mouth opening. Normal, it's free. Next, also we estimate conditions of the temporal mandibular joint. Research output of branches of trigeminal nerves. Wales point normal, exist point slightly sensitive but painless. And examination, especially palpation of lymph nodes. Lymph nodes of head and neck. Palpation to determine the size, the consistency, some characteristic of surrounding tissue or soreness. Next part of inspection, the examination of the oral cavity. Visual inspection and instrumental examination using a mirror and probe and tweezers. 3 main instruments during examination: mirror, probe, tweezers. Examination of the vestibule of oral cavity before teeth. Next, inspection of oral cavity, assessment of dentition, examination of the teeth and each tooth in detail, and assessment of the functional capacity of the seals, if it exists. And during examination of the teeth, we usually estimate. First, we provide visual examination using a mirror and hold sequence, probing or sensing the teeth, percussion, vertical and horizontal, and definition of mobility of teeth. After inspection, we move to the third method, which is called probing, and we use special instrument which is called probe. It is sharp and angular. This is probe, the instrument for probing. Probing allows to identify first defects and changes of the enamel surface, the density of the bottom and walls of the caries cavity, the pain sensitivity of the affected areas, and the depth of the caries cavity. Presence of caries cavity and its characteristic: density, pain, depth. We find out all this using probing and instrument probe. Next method, number 4 from the first basic group, is percussion. Percussion or tapping on the tooth. We tap on the tooth using special instrument. Usually we use tweezers or probe handle to tap the cutting edge or chewing surface of the tooth. It may be vertical. In first picture you can see vertical percussion in vertical direction and horizontal in horizontal direction. And the last method among this group among basic methods, number 5 is palpation. Palpation is used to determine the consistency, mobility of tissue and organs, and the pain response. Palpation is performed with all fingers of both hands. There are maybe superficial and deep palpation, and also extraoral and intraoral palpation. First perform a superficial palpation, then a deeper one. Deep feelings allows to determine the size, consistency, and conditions of lymph nodes, salivary glands, and their ducts. Assessment of the functional capacity of the cells. We estimate it during inspection and probing, both inspection and probing. We use probe and mirror and assess anatomical shape, cells, marginal adaptation of feelings to the surrounding hard tissue of the tooth, the state of contact point, state and degree of attraction of the surface, the line color, the color of the tooth, and the presence of secondary caries. Next group of methods is additional group, additional methods. And there are several methods: thermometry, electro-odontodiagnosis, radiography, vital staining, luminescence, trans-illumination, laser flowmetry. First one is thermometry. This is determination of the reaction of tissue to the action of thermal stimuli. Thermal stimuli. It may be heat or cold. An intact tooth with a healthy pulp reacts to the temperature below about 5 to 10 degrees and above 55 to 60 degrees. In caries, the tooth reacts painfully to the temperature below 18 to 20 and above 45 degrees. So to determine the reaction to cold, we use cold water irrigation, ice, dry ice, chlorophyll. And to provide cold test, for example, cold water, ice, aerosol, freons, you can see the cold test. And another opposite test to cold is heat test, to determine the reaction to hot, not to cold, just hot water, about 70 to 80 degrees, heated tool, and hot gutta percha. Next, second method, also additional, EOD, electro-odontodiagnosis. It's the technique based on the fact that diseased and healthy pulp tissue have different electrical excitability. A healthy nerve responds with pain sensation to the effect of current intensity of 2 to 6 microampere. And this is special device to provide electro-odontodiagnosis, pulp tester for EOD. And this device consists of device exactly and two electrodes. This is like hook, passive electrode, which is fixed to the lips, and another one, this is an active electrode, is placed on pre-dried tooth, like this. This is passive hook on lips, and this is active on tooth. Tooth with cavity or on the surface of the tooth most sensitive to electric current. For example, in the middle of the cutting edge or front buccal hillock. Gradually increase the current using special button to a small feeling in the tooth, and patient should feel some sensation, some not first feeling, and next it may be weak pain. So patient informs us about this feeling, and we look at the screen and we can see some number. And indicators: healthy teeth, normal reaction from 2 to 6 microampere. During deep caries it may be about 15 to 20 microampere. During pulpitis, different indicators from 20 to 80 microamperes, and periodontitis more than 100. Pulp is dyed, so it is not react to any electrical stimuli, electrical current. And as for equipment, pulp tester like this, like previous slide, you can see number of electrical current, and for example like this digitest also for electrodontal diagnostic EOD. And also about EOD, delivers a small electrical stimulus to the pulp. Factors that may influence reading: it may be teeth with large restorations, teeth with more than one root canal. Dying pulp can produce a variety of responses: wetness on the tooth during testing, and batteries in the tester may be weak, so it may flew the indicators. Next method, number 3, radiography. We use it to determine the hidden caries cavity, determine the depth and communication with the tooth cavity, and sealing quality also. For example, in this picture you can see just changes of color, not caries cavity, and also here. And in X-ray picture you can see changes which is caries cavity. So this method, X-ray, helps us to determine caries cavity and its depth. Here, caries cavity you cannot see, and after preparation it exists caries cavity. And classification radiological classification of caries cavity by depth. We use it when we characterized caries process, different caries classes. So K1 is cavity within the enamel no more than its half. This is K1, not deeper than half on enamel. This is enamel, this is dentin, and this is pulp. So K1 changes in only in enamel and also not deeper than 1/2 of enamel. K2 affected enamel more than half, not reaching the enamel dentin border. This line is enamel dentin border, and K2 caries cavity more than 1/2 but not penetrate into dentin, not reach the enamel dentin border. K3, this one K3, enamel and dentin caries less than half the thickness of dentin. K3 in dentin, also in enamel and also in dentin, but not deeper than half of thickness of dentin. And K4 also in enamel, in dentin, but more than half, deeper than half of dentin, but not reach the pulp. More than half, but not communicating to the pulp cavity. This is pulp cavity, and caries cavity, which is K4, not penetrate into this structure, this caries cavity. And the last one, K5, defect penetrates into the tooth cavity. Enamel, the whole enamel, the whole dentin, and even penetrate into the pulp cavity. 1, 2, 3, 4, 5. 5 classes of caries according to radiological classification. Next method, we continue additional vital staining. Vital staining is used for differential diagnostics of caries in the stage spots with non-caries lesions, assess the quality of edge sealing, and first we should clean the tooth from plaque and then apply the dye, some color. Then wash it off and evaluate the intensity of staining. First clean tooth, then dry a little bit, then apply the color, the dyeing, then wash it off and estimate. Coloring materials: methylene blue 2%, methylene red about 0.1%, and some other like carmine. Detector: caries detector, red, for example, red detector or blue detector it may be. Next method is luminescence. Luminescence is based on the different ability of tissue to reflect ultraviolet rays. It is used for determining the age fit of fillings, recognizes initial caries, and the study using Wood's rays is carried out in a shaded room from a distance about 20 or 30 centimeters. Equipment: we use microscope equipped with quartz lamp with a filter made of dark purple glass. And similar method, which is called trans-illumination. Next additional method is trans-illumination. The shadow formation observed when light passed through the object of study is evaluated. This study is carried out in dark room using a lamp polymerizer in caries. A limited hemisphere of dark color is determined. In acute pulpitis, the crown of the affected tooth is darker than the crown of healthy teeth. In chronic, there is a relatively dim glow of the hard tissue of the tooth. Trans-illumination also reveals enamel cracks and sublingual dental deposits. You can see lamp, light for polymerization, and we can see shadow. And next method is called laser flowmetry. Is based on the analysis of the optical properties of tooth tissue when they irradiate with a laser. The reflected light wave is converted by the electronic system of the device into digital indicators on the display or an audio signal. Allows to identify changes in the structure of enamel and is used to diagnose the initial forms of the disease as well as to evaluate the effectiveness of remotherapy. And equipment which is used for laser flowmetry is Diagnostic by Kava company. Next part of our lecture is medical documentation and rules for its registration. The main medical document of any medical organization is medical card of dental patient. You can see this our Russian medical card for dental patient. And it consists of several pages, and the main first pages is information about names, about age, about some address, profession, and first about data, passport data, and diagnosis, complaints, some data from anamnesis, concomitant diseases, and anamnesis of current morbid. Rules for filling out of medical card. Entries are made in Russia carefully without abbreviations. The card is issued for each first-time patient, and the card is filled out at each patient's appointment. The card contains data reflecting the nature of course of dental disease, complaints, examination data, preliminary diagnosis, additional examination data, clinical diagnosis, treatment plan, etc. Diagnostic and therapeutical measures carried out by specialists are recorded in strict sequence by filling in the appropriate sections. And the next part of our lecture and the last one is classification of dental caries. And there are several classifications, but first about definition of caries. What caries is? Caries is a localized pathological process that occurs after the eruption of the tooth under the influence of microorganisms characterized by the demineralization of calcified tooth tissue and the disintegration of the organic matrix followed by cavity formation. And first classification of dental caries, the clinical topography classification. According to clinic, there are 4 types of caries. First, initial caries. This is initial caries or stage of spot. Next, superficial caries. This is the caries only in enamel. Cavity in enamel is superficial caries. The third one is medium caries. Is caries in enamel and also in dentin. Medium caries. And the last one, deep caries, is deep process reaching almost the pulp, and first initial changes may be possible in the pulp. Initial, superficial, medium and deep. 4 stages of caries according to clinic and topography. Next classification according to World Health Organization or ICD, International Classification of Disease. And caries classified as K02. This is code, special code for any caries. K02 means dental caries according International Classification of Disease. And different stages of caries have special codes. K02.0 corresponds to caries limited to enamel or white spot lesion, or initial caries, its synonym. Spot or initial caries, spot caries or initial caries. Next, K02.1 is caries of dentin. K02.2 caries of cementum, and K02.3 are rested dental caries. Just 4 stages according to ICD, International Classification of Disease, or World Health Organization. The spot stage caries corresponds to enamel caries, code K02.2, code enamel caries. The stage of white or made spot means initial caries, and caries in the spot stage is characterized by demineralization, color change, made surface, and then the texture, roughness of enamel in the absence of carious cavity. No carious cavity in this stage. White made spot, just change of color, white spot that hasn't spread beyond the enamel dentin border. Next, caries of dentin, K02.1, code caries of dentin is K02.1. It's characterized by destructive changes in enamel and also dentin with the transition to enamel dentin border. However, the pulp is closed with a larger or smaller layer of preserved dentin and without signs of hyperemia. So changes in enamel and in dentin but not involve pulp. in process, in inflammation, without changes in the pulp. And next code, K02.2, stage of caries of cementum, corresponds to code according to ICD K02.2. It's characterized by a lesion of the exposed surface of the tooth root in the cervical region, where the cement covers the root, and it may be distract its caries of cementum. And the last one, the stage of arrested caries, corresponds to the ICD code K02.3. It's characterized by the presence of dark pigmented spot within the enamel, focal demineralization of enamel. Dark spot or pigmented spot means arrested caries, K02.3. Next classification. Depending on localization according to Black. And Black divided caries cavity into first into 5 classes and next into 6 classes. And now we have classification according to Black, 6 classes. First, second, third, fourth, class number 5, and class number 6 according to Black. Class number 1 according to Black. All Pitt and Fisher restorations are class number 1, and they involve the following 3 localization. Occlusal surfaces, here in occlusal surfaces of molars and premolars. Occlusal 2/3 of buccal and lingual surfaces of molar, and lingual surface of anterior teeth. So 3 localization for the class number 1. Occlusal surfaces of molar and premolar. First 2/3 of buccal and lingual surfaces of molar, here, and lingual surfaces of anterior teeth, incisors and cusps, canines. Occlusal surfaces, 2/3 of buccal surfaces, and lingual surfaces of, for example, incisor. Class number 2 involve the proximal surfaces, mesial and distal, of posterior teeth, also molars and premolars, with access established from the occlusal tooth surface. This and this. Mesial and distal surfaces of molar and premolar, class number 2. Class number 3 involve the proximal surfaces of anterior teeth, incisors and canines, which may or may not involve the lingual extension, but don't involve the incisal line angle. Angle is not involved in the process, just mesial and distal surfaces. Class number 3. Class number 4 involve all proximal surfaces of anterior teeth, which also involve the angle, the incisal line of angle. Class number 4. All surface including angle, class number 4 of anterior teeth. Class number 5 involve the cervical third of all teeth, including the proximal surfaces of posterior teeth where the marginal ridge is not include the cavity preparation. In this region, cervical third, any teeth, molar, premolar, canine, incisor, here, for example, here. And class number 6 involve the incisal edges of all anterior teeth and cusps, tips of posterior teeth, like this. Incisor edges of anterior teeth and cusps, tips of posterior teeth. Not typical affection, not typical localization, so special class number 6 according to Black.
Make the ground shake.